Would you like to tell us about it?
No, I mean, if there's a counsellor here, I do need to talk about it. But there are little pockets of things which don't quite fit to the broad.
I think Gregor could help you a bit there, John.
It's like, I know we're coming to the end of the panel session. It's like being in the GP surgery, and at the very end, you've got 20 seconds or something left, and that's where the most fundamental things come out. I'm not saying the earlier questions and the attempts to inject some humour and levity that haven't been helpful, but the lady who's just spoken and Bobby's analysis is really getting us to the heart of the issues here. And it really is, you used a wonderful phrase, which was, it's changing the background design. And the element to which we have the courage and the strength and the commitment to change that background design, which is more than just the environmental, it's a fundamental reshift of what we would value as social progress, and the measures by which we choose to do that. And we can measure some of that by economic growth, or we can measure it by levels of well-being, which can be based on things like spirituality, connectiveness, etc. And the woman who talked with the pink spots, though I'm sure that's not your defining feature, is you beginning also to get to the heart of it, when you talked about empowerment and engagement, and how people do want a sense of empowerment, how they can be and are engaged, and when they are given back that sense of control over their lives, the difference it can make to themselves and others. And I think if we translate that up to a much more macro level, we have to begin to realize there are limits to government and what we can expect for government to do. Okay. So I'll say it on a panel, I fundamentally disagree with John. We cannot leave it to the legislators and the politicians. We've been doing that, and what have we got now? We've had the opportunity to change in the way in which we looked at what would measure our social and economic progress, but we haven't. We're continuing to pour more money after what we know is not going to do us good. So it seems that economics has once again trumped ethics.
Okay, I think we're going to take just one more question at the back. And could I ask the very short, sharp question? And could I ask the panel to try and turn your answer to the question, and I'll give you each a chance to, into a sort of very brief take-home message for our people. So let's have the question.
Thank you, and I'm grateful that Gregor mentioned ethics, because I am actually an ethicist by background, but I'm also a member of a PCT. You talked, Gregor, about the absence of prevention in the mental health sphere. And, if we're looking at prevention in public health terms as the Cinderella part of commissioning, then goodness knows mental health prevention doesn't even get a look in. And I'm just grateful if the panel could have some thought or idea as to how we redress that disconnect when we're talking about issues such as obesity, drug use, other self-harming issues, as if they do not stem so very often from adverse mental health situations. And if we don't get round to putting some money into mental health prevention and promotion, I fear for us.
Okay, so let's turn that into a question about the well-being agenda, which well-being is very much part of this whole thing. So if we start with Gregor and just work down the line, and if you could sort of frame your answers around that issue of well-being and how it fits into this whole debate, one by one, starting with you, Gregor.
There is a danger that we will leave the elephant in the room, and we have a real opportunity, as our colleague there has said, to give mental well-being a much bigger platform. So how we think, feel, and behave really fundamentally matters, and that needs to be brought much more centrally to the issue of concern of public health, and it's everyone's responsibility in this room to do it, because mental health activists will not do it on their own.
Thank you, Gregor.
And my comment, I think, would be to say, recognising how closely interrelated mental health and physical health happens to be. And one good example of that is, for me, the terrible scandal of the number of people who get a musculoskeletal disorder, usually at work, but not only, and end up sitting at home with GP's advice to go and rest, don't get access into the treatment they need, which is frequently early intervention physiotherapy, which they can do by self-referral in many places. And one consequence of that is that they then end up moving from an acute phase of illness into a chronic long-term phase of illness. And in turn, a number of them end up on incapacity benefit. And the ultimate scandal of that is the loss of hope, the depression that goes with that, the despair that goes with that, and the effect on families is ignored. And ultimately, you then have the wonderful scandal of large numbers of people on incapacity benefit, 25% of whom have a musculoskeletal condition, being blamed for the fact that they are incapacity benefit recipients, when in fact the whole system that we've got does not address their needs, their mental health needs together.
Okay, thank you.
So in sum, I think my message would be to say it's not a question of nudging or nagging only, it's both, but it's also a question of looking at the whole ethics of the workplace and of the society that we live in if we're going to ensure better public health.
Thanks, John.
I can only speak from my own fitness and personal training practice, and what I would say is this, that as people move into health and become fitter, it does amazing things for their self-esteem, for their sense of self-worth, the value they feel of themselves, the contribution they can make to a wider community. And I could give you case history after case history after case history which demonstrates that. It's just fantastic what happens to people.
Yeah, Steve?
If I could link my response to that one to the previous remarks about redesign. My two areas of expertise, I worked for 35 years in the city, and my wife has been a teacher for 35 years. In 1975, when we got married, our average working week was about 35. Now it's somewhere around 60. And I think that as a society, we have pushed more and more pressure on people in the workplace. We have changed our value system from a wider social aspect into a narrow field of results and money. And I think we've got to go for a radical redesign of everything we do in the workplace, because it has an amazing effect on people's mental health.
Yeah. Bobby?
Okay, I go for the person over there who also talked about background design in this, because it's the hip bone connected to the everything else. That's the real point of the questioner here. And of course, some people would think that the unifying background design was, up there somewhere, that would keep us happy and well. But in fact, I would go for Richard Wilkinson's way of articulating it. He was the key author of The Spirit Level that identified income inequalities and its relationship to ill health. And he said the trouble with people who have this sort of medical and one-issue model in their mind, be it alcohol, tobacco, or nutrition, say this is the cause of ill health and the greatest cause of health inequalities. So people recognize that diseases now are multi-causal, but as Richard says, they don't recognize that causes are multi-diseasal. So it's the same actions that will have an impact on mental health and many aspects of physical health. So we're just recognizing that, the stroke pathway is connected to the heart disease pathway. And if I could sing it properly. So I think that is...
Please don't.
That's the atheist's answer.
Thank you very much. Okay, well, I think we've come to the end of the debate now. Quite a few things have come out of it. I think very useful discussion. I think the nagging, nudging thing, clearly it doesn't just apply to patients, to clients, to the public. We also have to find the right nudge balance, as it were, with health professionals in order to get them on board with the whole health promotion, public health message, and increasingly, and especially at this moment in time, where the nagging and the nudging of the policy makers themselves, the politicians at the national level, politicians, but also local policy makers. They need a bit of nagging and nudging as well to make sure that they're trying to make sensible decisions in such difficult circumstances.